The outrageous cost of prescription drugs is a crisis in America, where we pay some of the highest prices for medications in the world. Welcome to Care Talk, where we talk about how healthcare works or doesn't work in America and answer your health insurance and healthcare questions. I'm Laura Packard, cancer survivor and healthcare advocate, here to help you. Please text or call in your questions at 202 838 6837, and we'll answer them in future episodes. Be sure to subscribe to my channel or podcast wherever you get your podcasts to get next week's show. In today's episode, health policy expert Vincent DeMarco talks about the causes of high prescription drug prices and what we can do about it, including successes in Maryland. But first, we're going to answer some of your health insurance questions with Louise Norris of healthinsurance.org. So, welcome back, Louise.
Thanks, Laura. Great to be here.
So first, let's start with the budget bill that Congress has been working on and we've been talking about for several months now. The U.S. House did pass a final version of it last week. So can you tell us what's in it and what changes it would make to Medicaid and other programs?
Sure. So there's a lot that is in this bill, a lot that affects health policy. If we look on the Medicaid front, the bill cuts about $700 billion in federal funding for Medicaid. And Medicaid is jointly funded by the states and the federal government, but the federal government does fund the majority of it. So with a funding cut of that magnitude, which is historic, there has never been a Medicaid funding cut of that magnitude in the past. In order to keep eligibility and enrollment unchanged, states would have to make up the difference, and states generally can't, they don't have the funding for that. So any way you look at it, the result of this magnitude of federal funding cut is that fewer people will qualify for Medicaid and or benefits will be reduced. So some of the provisions that are in this bill for going about that, first of all, would be a Medicaid work requirement nationwide for anyone who's in the Medicaid expansion population. So that's low-income adults. The bill would require 80 hours per month of work reported by the enrollee, and that's the catch. Most Medicaid expansion enrollees are already working, or they are a caretaker for a child or an elderly person or a disabled person, or they are disabled themselves and unable to work. This bill would basically make it to where they would have to report their work or lose their coverage. And for people who aren't able for one reason or another to jump through that hoop, coverage would terminate. The bill also would require Medicaid expansion enrollees. And just to clarify, there are about 20 million people covered under Medicaid expansion right now. These are folks who got Medicaid because of the Affordable Care Act. This bill would require them to have their eligibility rechecked every 6 months instead of once a year, the way it is now. So again, every time you have another eligibility recheck, some people who are actually eligible for coverage won't complete the process for one reason or another and will lose their coverage. So just like the work requirements, this would cause people to lose their coverage. The legislation also calls for rescinding a couple of Biden administration rules that had made it easier for people who are eligible for Medicaid to complete the enrollment process and get signed up. So this bill would repeal those rules and, in turn, make it harder for people who are eligible for Medicaid to get enrolled. It would also add copays for some services when people get medical care for Medicaid expansion. Again, this is the Medicaid expansion population. People with income over the poverty level would be faced with new copays up to $35 depending on the service. The point of this is to make it so that people don't seek the medical care in the first place, because if you get to the point where people aren't getting care, then Medicaid isn't paying for that care. So this is a way of cutting funding by reducing the number of services that people receive. But unfortunately, when people don't get the medical care that they need, then their health conditions tend to get worse and in the long run, they might end up needing more medical care. There are also penalties in this bill if states erroneously enroll people in Medicaid who aren't actually eligible, or for states that use their own money to provide Medicaid to undocumented immigrants, which some states do. Federal funding can't be used for that, but some states use their own funds, and this bill would penalize those states by reducing their funding for Medicaid expansion, which is separate. But again, so all of these provisions, and this is not an exhaustive list, that's some of them, but all of these provisions are designed to very significantly cut federal Medicaid funding and will result in millions of people losing their Medicaid going forward.
Thanks, Louise. And let's talk about what are the changes to the Affordable Care Act, which this bill also makes some significant changes.
Yes, absolutely. So primarily what they focused on in this bill as far as marketplace coverage is things that were already proposed a few months ago by Health and Human Services. Health and Human Services had made a large rule change proposal that they wanted to take effect for the 2026 plan year to do a wide range of things, but this legislation includes those same changes. The reason for that is if you get something into law, it's much harder to undo in the future. So if they just finalize the proposal that HHS already made, then those changes will take effect in 2026, but a future administration could just reverse them and change them back. Whereas if you get it into legislation, then you have to have approval from Congress in the future to change it, which makes it more permanent. So there's a long list of things, shortening the open enrollment period. And just to clarify, the long list of things is also intended to cut federal funding on premium subsidies in the marketplace by reducing the number of people enrolled, similar to Medicaid. So shortening the open enrollment period, in most states, it currently goes through January 15th at least. This proposed rule would end it on December 15th, which means if you don't pick a new plan for 2026 by December 15th, you would not be able to make a change after that or sign up after that unless you qualify for a special enrollment period. They want to eliminate the year-round special enrollment period for low-income people. There's currently, depending on your income, you may be able to enroll year-round in a marketplace plan, and they want to do away with that. They want to eliminate DACA eligibility so that DACA recipients can't get marketplace plans. That used to always be the case, and then starting last year, the Biden administration made a rule change to allow DACA recipients to enroll in marketplace plans. This legislation would end that, and there are already some states sued, and right now if you're a DACA recipient, you may or may not be able to use the marketplace. It depends on where you live. This law would eliminate that access nationwide. They also want to make some changes to passive re-enrollment. This is where folks just have coverage in the marketplace, and they don't go back in during open enrollment and actively compare their options or update their information. Their plan just renews. To be clear, that is not a great idea. If you have marketplace coverage, you should not don't let your plan automatically renew, because that's not in your best interest. Your plan might be changing, your price might be changing, provider network, drug list, these things all change. So it's always in your best interest to actively renew your coverage. Go in and update your information in your marketplace account and actively pick a new plan, which might be the same plan you already had, or might be a different plan, but you don't want to let auto renewal do it for you. But the way it works now, you can let auto renewal do it for you, and your subsidy will stay calculated based on the information you'd previously provided. This legislation would change that quite a bit, would make it. There's some conflict in the legislation. One part of the legislation indicates that they would just remove premium subsidies in that case. Another part indicates they would just reduce premium subsidies. So these are the sort of things that would need to be worked out in the Senate version. But definitely they are working to make it harder to passively automatically renew your policy. They're also trying to change the indexing methodology that they use to determine like the size of premium subsidies and out-of-pocket costs. If they do this, it will make premium subsidies smaller and out-of-pocket costs higher. So not great for consumers. And then also make it to where states can't cover gender-affirming care as part of their benchmark plan. So just a wide range of things. One last-minute addition that was in the manager's amendment to the bill right before they passed it was to fund cost-sharing reductions in the marketplace, which sounds maybe good on its face because the previous Trump administration had stopped funding cost-sharing reductions. But from a consumer perspective, what it would actually do is reduce everybody's premium subsidies because states and insurance companies addressed the previous funding cut by just adding the cost to silver plan premiums, and premium subsidies are calculated based on silver plan premiums. So those have been higher, which meant everybody's subsidies were higher. If they fund cost sharing reductions, everybody's subsidies get lower. And of course, a part that is conspicuously missing from this bill is extending the subsidy enhancements in the marketplace that we've had for the last several years. So all of these pieces together will result in fewer enrollees, higher out-of-pocket costs, and higher premiums.
Thank you, Louise. And now a question from one of our viewers. BJ Keith wants to know what will happen to states that offer Medicaid with SSI approvals if they cut Medicaid?
So the legislation doesn't specifically address this. Medicaid eligibility is set at the state level within certain parameters that the federal government lays out. States are not required to automatically provide Medicaid to SSI recipients, but most of them do. So the way it currently works is in most states, if you get approved for SSI, you are automatically eligible for Medicaid and automatically enrolled in Medicaid. There's nothing in this bill that would require that to end. But again, going back to what we talked about earlier, the overall point of this bill when it comes to Medicaid is to cut federal funding, which will force states to make changes to their eligibility and benefits. So that's not to say that states necessarily would make a change to how they process eligibility for folks who receive SSI, but they might. So just like anyone else with Medicaid, if you are enrolled in Medicaid through any pathway, this bill is a threat to your benefits and eligibility simply because states will be contending with reduced funding and needing to figure out ways to address that.
Thank you, Louise. And this bill has passed the US House, but now it moves over to the Senate. It has not passed the Senate. The Senate will be working on this bill or a version of this bill for the next month or two. So you have time. If this bill threatens your healthcare or someone you love, someone you know, you can and you should contact your two senators and your representative and tell them, don't cut Medicaid, don't cut the Affordable Care Act, don't cut Medicare, don't cut the healthcare that we depend on. Thanks. And now I'm pleased to introduce Vinny DeMarco, the president of Maryland Healthcare for All, and he's going to be talking about prescription drug prices. Vinny?
Can you hear me?
Yes.
Great. Thanks for having me.
So let's start with everyone is probably aware that we pay some of the highest prescription drug prices in the country. And why is that?
In the world.
In the world.
Yes. We in America pay the highest of industrialized nations because we have allowed Big Pharma to gouge us for way too long. I remember one of my heroes, Representative Elijah Cummings, who now passed away, but he was interrogating someone from pharma who was gouging us on some critically needed drugs. And he asked them, why do you do that? Why do you increase your price 5,000%? And his answer was, because we can. And that's what they've been doing. And we've had people testify in Maryland over and over again how high cost of drugs cause them to lose their homes, their jobs, their families, their livelihood, their health. And Some people die because they can't afford their drugs. The fact is, drugs don't work if people can't afford them. And we are starting to do something about it. The Inflation Reduction Act that President Biden got enacted in 2022 is for the first time allowing Medicare to negotiate with the drug corporations, and that is making high-cost drugs much more affordable for people on Medicare. At the state level, we are working to make high-cost drugs more affordable for the rest of us with prescription drug affordability boards.
So, Vinny, can you tell me more about the Prescription Drug Affordability Board that was set up in Maryland a few years ago? What is it doing, and how does this benefit Maryland patients?
Well, the law was the first of its kind in the nation, enacted in 2019, and it created this board. We wanted the board to have the authority to put upper payment limits on what everyone pays for high-cost drugs. The legislature wasn't ready to do that. It gave them the authority to make high-cost drugs more affordable for state and local governments, with the idea that we would come back and give them further authority to make high-cost drugs more affordable for everyone. We thought we could do that in 2023, but our former governor delayed things and caused a lot of problems. Luckily, Governor Westmore came into power committed to the Prescription Drug Affordability Board, got it fully funded and ready to go. And now the board is set to make high-cost drugs more affordable for state and local governments. And because of that, our General Assembly passed legislation, which Governor Moore just signed last week, authorizing them to make high-cost drugs more affordable for all Marylanders. They could do that starting next year. This year, they are about to implement the authority they have now to make high-cost drugs more affordable for state and local governments. This is very important. Stuart Pittman, the wonderful county executive of Anne Arundel County in Maryland, says that in his county, they spend more on prescription drugs for county employees than on libraries. They are just being gouged. This board will help them. They are focusing on two drugs, Farxiga and Jardiance, which are diabetes drugs and budget busters for state and local governments. Our hope and belief is that this year sometime, the board will set up upper payment limits above which state and local governments can't pay higher than for these drugs. As a result, taxpayers will save millions of dollars, and that will be great for all of us. And this will be historic. It will be the first of these boards to do that. And then starting next year, the board can make high-cost drugs more affordable for all Marylanders. 3 states, Colorado, Minnesota, and Washington, have enacted similarly strong prescription drug affordability board laws that have not been in place yet, but have not been fully implemented yet, but soon will be. Marylanders are going to benefit soon from this innovative approach of the Prescription Drug Affordability Board.
So let's talk a little bit about the Inflation Reduction Act. As you mentioned, that is a federal law, and that affects drug prices for people on Medicare. And the prescription drug affordability boards are specific to a state, and they affect people in those states with a variety of different insurances, right?
Yes, everybody. Everybody in the state, except people covered by federal plans. The Prescription Drug Affordability Board won't affect people on Medicare or people who say work for the federal government or in the military, et cetera. But the rest of us, the board will limit how much we pay for high-cost drugs so that people who are now unable to afford their drugs will hopefully be able to.
So the pharmaceutical companies...
let me just add, and we all benefit because even if you have a good insurance plan so that you don't pay much for your drug, you pay for these high-cost drugs because your insurer is paying so much. Our wonderful lead sponsor, Delegate Bonnie Cullison, says that even though you may pay $10 for a certain drug, your insurer is paying $22,000. And you see that in higher premiums. And our insurance commissioner, Marie Grant, testified that she will make sure that the insurers pass those savings on to consumers. We will all benefit by what this board does.
So Maryland is really leading the way, but I assume that pharmaceutical companies don't like having less profits. So it was hard to get it passed in the first place, and it was hard to get it expanded, right?
Yeah, exactly. The pharmaceutical companies fought this tooth and nail. Their main argument is they need these high prices to fund their research on life-saving drugs. But the fact is, according to a report by Public Citizen, every year they spend $20 billion or more on profits and advertising, all those ads you see all the time, than on research. And as our wonderful Senator Chris Van Hollen points out, a lot of the research is paid for already by the federal government. So the fact is these drugs can be made more affordable, and we can have the necessary research. So Big Pharma fought this tooth and nail, but we overcame that because we told stories like Erica Miller, who lost her job because she couldn't afford her mental health medicine. Larry Zarzecki, who lost his house and his family because he couldn't afford his drugs. So, and we built a powerful coalition of faith, community, labor, business, and healthcare groups across the state, made an election issue, and overcame the power of pharma. And every other state in Maryland can do the same.
So Maryland has not yet, but is about to pass upper payment limits. Can you talk about what is an upper payment limit and how does this affect patients?
Yes. Upper payment limit is different than price because the state can't affect the price of a drug that a drug company charges all across the country. But we can say you could charge whatever you want, but this is what we will pay. And this is what other countries do all the time. And that's how come their people can afford their drugs while we can't in many situations. So right now, the board has the authority over state and local governments. Let's take these two drugs, Jardiance and Farxiga. For those two drugs, our board, I believe, and nothing's definite yet, but I believe this is what they will do, will say this is the upper payment limit, which may be what CMS has done for Medicare. We are not going to pay any more than this. It's a reasonable amount. You'll still make profits, but this is what we're going to pay, and our people will save lots of money. Next year, they'll be able to do that for all of us so that uninsured will pay less for their high-cost drugs and insurers will pay less. And because the insurers will pay less, our insurance commissioner will make sure that all of us will benefit from that.
Mm-hmm. And so in Maryland, the board is looking at potentially two drugs. Are they looking to expand that eventually? Like the Inflation Reduction Act started out with a small group, and then each year they're negotiating more and more drug prices.
Yes, there are other drugs they're looking at, Ozempic, Trulicity, or others that they're looking at. They will be looking at a lot more drugs. There are no limits in the statute on how many drugs they could look at, but they're doing it in a smart way by testing the process with a couple of drugs. It's the first time any state will have done this, and figuring out how it works and then expand it to others. So I'm very confident that this board will do a great job. The chair is Van Mitchell, former health secretary, former legislator, very smart man, and the executive director, Dr. Andrew York, is absolutely expert on this. So I'm very confident that the board will do this right.
And when Nevada tried to cap insulin prices, the insurance companies immediately sued. Is this actually going to happen this year, or are the big pharma companies going to keep it locked up in lawsuits?
Well, in Colorado, which also has a prescription drug affordability board law and is looking at a drug called Enbrel to put upper payment limits, the drug corporations did sue, and their suit was dismissed. The court said nobody's done anything to you yet, so you have no right, no standing to sue. So yeah, they'll try to sue. I think they will lose, just like the drug corporations are suing to stop the Inflation Reduction Act from taking effect. Loss, loss, loss. Because the fact of the matter is, we have the authority and the obligation to make high-cost drugs more affordable for our people, and that's what Maryland is doing, thanks to Governor Westmore and our General Assembly.
What should people in states other than Maryland do so that they can follow your lead and start getting cheaper prescription drugs?
Well, it's a good question, and some states already have laws like Colorado, Minnesota, and Washington, which have boards with full authority, and they could look at how our board is implementing and follow that lead. Other states have PDABs with now full authority. They need to pass additional legislation. One lesson which I would urge them to follow is to build a broad coalition, because pharma will fight this tooth and nail. But when you bring together the faith community, labor, business, healthcare groups, and people with stories from all across the state, that overcomes the power of pharma. This can be done, and we believe that what Maryland announces this year with upper payment limits will start a real firestorm of these all across the country.
Is this something that if we had a more functional Congress could or should be done on the federal level? Or is this always going to be a state issue because state insurance plans are run differently than federal regulations?
Well, a functional president and Congress did enact the Inflation Reduction Act in 2022. And that law makes high-cost drugs more affordable for people on Medicare. And at some point, we could have a functional president and Congress that it could expand the IRA to everyone. That could be done. But until then, we need prescription drug affordability boards at the state level to make sure all of us get the same benefit that people on Medicare get. The fact is, drugs don't work if people can't afford them. And we have the ability to make high-cost drugs more affordable for people.
Speaking as a Virginian, I was incredibly disappointed that the legislature, again, did their part. They passed a bill to establish a prescription drug affordability board here in Virginia, but the governor, again, vetoed it. So, what would you have to say to governors or legislators that oppose these prescription drug affordability boards? You know, maybe they're listening to pharmaceutical lobbyists or other folks. You know, how are they missing the benefits for patients there where we're paying way too much for our drugs?
Well, the fact is, it is very unfortunate that Governor Youngkin twice vetoed prescription drug affordability boards. We hope that the next governor of Virginia will sign it. And what that next governor will have that Youngkin didn't have is evidence of Maryland's board working. By the time your next governor is in place, he or she will have the ability to know that prescription drug affordability boards work to make high-cost drugs more affordable. They'll have the Maryland example. And we urge them to think carefully about the fact that the people of Virginia, like the people of Maryland, like the people in every state, don't believe the pharma lies. We tested in a poll. Do you think that high-cost drugs need to be this high to fund research, or do you think the drug corporations spend too much on advertising and profits and can make these drugs more affordable? 88% of people believe the latter, believe that drugs are too expensive because the drug corporations spend too much on advertising and profits. And they're right. It's true in Maryland. I'm sure that's true everywhere. Good policy, good politics, and we hope the next governor of Virginia will sign a prescription drug affordability board law.
Thanks. And it's easy to see. The evidence shows that all the other countries are paying less for their prescription drugs. We are being price gouged on prescriptions in America, and there's no reason for it. There's no reason that we should be paying 3 times other countries pay for the same drugs that taxpayers paid for a lot of the intellectual property, the development of those drugs in the first place. And then we're paying outrageous prices when we actually need to buy them. How did this happen that other countries were able to negotiate more reasonable prices and America just fell down?
Simply because every other industrialized nation has something like a prescription drug affordability board, which says you can charge whatever you want, but this is what we're going to pay. And the drug companies understand that and they live with it, and they'll live with it when we do it here also. There's no reason why we should not do the same thing these other countries do and say, okay, we are going to determine the reasonable amount that we will pay for these drugs so that people can use them and keep healthy. Drugs don't work if people can't afford them. And we in Maryland are going to show how a prescription drug affordability board works this year.
Thanks, Vinny. And any last thoughts for people that are watching and want to know how to follow what Maryland's doing, or if you're a Marylander, how can you see this affect your prescription drug prices?
Just go to healthcareforall.com. If you go to healthcareforall.com, you'll see what's going on in Maryland and how you can help. And what we're asking people to do is tell us stories of how high-cost drugs are hurting you, and we'll pass them on to our board. And thank you, everybody in Maryland who made our success happen, especially Governor Wes Moore and the Maryland General Assembly. Thank you, Laura.
Thanks. And thank you, everybody, for joining us today to learn more about prescription drug prices and also changes to the federal budget. Please text or call in your health insurance and healthcare questions at 202-838-6837, and we'll answer them in future episodes. Join us next week on Monday for more on healthcare in America. Be sure to subscribe to my channel or podcast wherever you get your podcasts. My name is Laura Packard, and this is Care Talk.